Gabe, how are you?
I'm doing all right. Thank you.
Very good.
Yeah.
So, will you please tell us just first a little bit about yourself, your training, what you're currently doing here in your practice?
I am a physical medicine and rehab specialist, medical doctor. I work at the VA, and I deal with musculoskeletal issues, neck pain, back pain, joint pain, tendonitis and things like that. I do a lot of injections to treat those, physical therapy that I order, and I also do interventional procedures like epidurals and nerve blocks.
Sounds like you're really busy doing lots of good things for patients.
I am busy, yeah.
Yeah. All right. Will you tell us briefly what happened at the beginning of the year?
Yeah, so actually I was in my best shape. I mountain bike, so I have achieved over the season here when it's colder. I think the best physical shape I've been on ever, and I feel great. And then out of the blue I got what I thought it was a cold and fever, and I thought it was just bronchitis, but it turned out that it was influenza type A, the flu, which I'm vaccinated for. So that was a surprise. And it got real bad. It put me in the hospital, put me in the ICU, and then when I was there, they told me that I had heart failure.
Wow.
Yeah, so that was pretty surprising and upsetting, you know, 'cause I went from being in great shape, and in 2 weeks, a week and a half, I was in heart failure. 30% ejection fraction, which means my heart was not pumping too well,
That's
as you know,
scary.
and double pneumonia. So I spent about 4 days in the hospital, day and a half at the ICU.
Okay.
And I was discharged as a heart failure patient.
And then what happened?
So I went home, and I got home. I was discharged on oxygen. That's how severe my pneumonia was, and my heart issue. So they discharged me with a vest that would shock me if they detected a abnormal rhythm remotely. So I was pretty strange, and
You mean like V-fib or something like that?
Right, because they said that I was at high risk of having a heart attack.
Oh, wow.
So that was very traumatizing for me. Yeah. Anyway, I was discharged as a heart failure patient, and I was in oxygen at home for about 3 days, and I slowly started to be able to walk. I could barely walk from my room to the living room. I would be short of breath, and that's what happened. And then I slowly started to get a little better, and I started to. They told me that I should be able to, with medication management, to be back to about the same shape I was before this happened in 6 months.
So that would have put you when?
October, the end of October.
End of October, okay.
Yeah. So meanwhile, I remembered I was trying to figure out what to do, because I wanted to try to give my heart a chance to heal. So I remembered the regenerative medicine option with stem cells, autologous. So I made my way to you to have that done about a month after I was discharged, maybe 2 months after I was discharged, 6 weeks.
Okay.
Yeah.
All right. So you came here for autologous stem cell deployment. You had seen that procedure done.
Yes.
Correct?
Yes.
So tell us about the procedure in terms of discomfort, pain, side effects, anything like that?
So I was a little, I mean, it's not the same to see it done in somebody to have it yourself.
Sure.
So I was a little anxious, but not too much. But it was a piece of cake. It was. I mean, you numb it real well. The staff was great. I had it done. It was quick. And then I had my binder, abdominal binder for a little shell type for a day, and then we took that off the next day, and it was just a Band-Aid. I thought I was gonna be bruised, but I wasn't.
Good.
And I really have no, I did not have any significant discomfort whatsoever.
So then once we harvested your fat and then got your stem cells, we get that back to you intravenously.
Correct.
Subsequent after that, can you tell us then what happened to your heart and
Right.
exercise and all that stuff?
So I was in a comprehensive program where I was on supplements to help my heart heal. You started to help me also with my hormones to optimize my healing and my heart function. And I would say about 2 weeks after I had that done, I just started to feel better and be less winded, and that continued over the week. I was surprised because I was thinking this is gonna take 4, 5, 6 months maybe
Sure.
to notice,
Yeah.
but no, it was quicker than that. Not immediately, obviously, but 6 weeks I started noticing improvement, and it continued and continued, and then I started riding my bike again, slowly watching my heart rate, and continued, and I would say within a month and a half I was riding my bike fairly comfortable, not pushing myself but comfortable. So I was kind of really glad my body was just bouncing back.
Excellent, excellent. So what are your plans for the future?
Well,
Are you going back, you're back to work?
I'm back. Yeah, I was only out of work for 6 weeks, and that procedure also allowed me to return to work without being winded, and I feel back to normal now. I'm working, I don't get tired. I feel great, and I feel great now. I felt great a month ago, so it's not like, so I think I got ahead of schedule 2 to 3 months when I was told. So my plan is to get off, with the cardiologist, get off my medications right now, because I also had AFib during my episode,
Right.
and that's gone away so far, and get off my medications and just continue my life, being active, mountain bike, and take care of my heart, be more aware of my heart, just not ignore it. But I think my heart's going to be back to, I'm pretty sure, where I was, because that's the way it feels right now.
Excellent.